Hello friends, welcome to the new session of Hospital and Clinical Pharmacy Practical. Myself, Ms. Malvi Rajendra Bhavsar, M.Pharm in Pharmaceutics. So, today we are going to deal with again new practical of Hospital and Clinical Pharmacy. So, let's start with experiment number 21 to study different sterilizer. So, learning objectives. Student will develop intervention skills by understanding the concept of sterilization to understand the principle of different sterilizer. And student will again develop the motor skills by first ability to understand the working and construction of different sterilizer, and second ability to operate different sterilizer. Then first we'll see prior concept. Sterility and sterilization are a core consideration in all health-related area. Pharmaceutical products are generally required to be free from contamination with microorganisms like bacteria, virus, yeast, molds, etc. Such organisms may cause spoilage by adversely affecting the appearance or a composition of product and may cause serious adverse effect in the patient. So, adverse effects are particularly likely if the preparation is introduced into the body via route which bypass some of the body's normal defense mechanism, especially in seriously ill or immunocompromised patient. Dosage form designed for the parenteral, ophthalmic or surgical use, as well as irrigation solution and topical preparation for the application to large open wound must be free from the microbial and particulate contamination. These products are required to be prepared and maintained in sterile state until use. Sterilization is a subjection of a product to process whereby all viable life forms are either killed or removed. The sterilization process is usually the final stage in the preparation of product. The methods of sterilization in regular use include exposure to saturated steam under pressure, dry heat, ionizing radiation, ethylene oxide or passage through a bacteria returning filter. When possible, exposure to the steam under pressure is the sterilization method of choice. A suitable sterilization process may be selected to ensure the maximum microbial kill or removal with the minimum product deterioration. So, these are the different methods of sterilization. It can be classified into following categories. Sterilization methods are classified into main three categories: physical method, chemical method and mechanical method. Physical method includes again three categories: dry heat sterilization, moist heat and radiation sterilization. In dry heat sterilization, it can be done by hot air oven, flaming and infrared radiation. Moist heat sterilization, it can be done by autoclave, heating with bactericide, heating at 100 degrees Celsius, pasteurization, tinderization and heating at 55 to 60 degrees Celsius. Radiation sterilization, it can be done as ultraviolet light and gamma radiation. Then comes chemical method. It is classified again under two class: gaseous sterilization, sterilization by disinfectant. Gaseous sterilization include ethylene oxide, formaldehyde and beta-propylactone. And sterilization by disinfectant will be including alcohol, isopropyl alcohol, iodine, chlorine, cresol, soap solution, phenol and formaldehyde. Then comes mechanical method. It is sterilization by filtration. It may include membrane filter, SACE filter, cinder glass filter, Berg-Field filter, millipore filter, Pasteur Chamberlain filter. New concept. In the first we will be seeing principle of sterilization, then working and construction of sterilizer, advantages and disadvantages of sterilizer. First is autoclave. Autoclave is used to carry out steam sterilization, also known as moist heat sterilization. It works on the principle of utilization of saturated steam under pressure. Autoclave is more effective than hot air oven because steam has more penetrative power and thermal capacity than dry heat. Saturated steam under pressure causes coagulation of cell protein, leading to the destruction of microorganisms. The steam penetrates in the spores and capsules of bacteria, ruptures it and escapes the protoplasm, which is coagulated. Advantages of moist heat sterilization. Because of high penetration power of steam under pressure, microorganisms are killed more efficiently and lesser in time at allowed temperature than dry heat. Second advantage, in large size autoclaves, large quantities of material can be sterilized in one batch. Solution packed in the sealed container as the ampules are readily sterilized by this method. Bulk solution, glassware, surgical dressing, rubber gloves and surgical instruments are effectively sterilized by this method. And disadvantages of moisture sterilization. This method is unsuitable for the material which cannot withstand the heating at 115 degrees Celsius or more. This method is not useful for oils, fats, ointment, powder, oily injection and other preparation through which steam cannot penetrate. The working of autoclave. First, you have to remove the inner basket and fill the cylinder of an autoclave in such a way that it does not touch the bottom of inner coil. Then clean the articles properly, which are to be sterilized. Third step, wrap, pack and seal properly the article which are to be sterilized. Load the articles in basket of an autoclave by maintaining sufficient space between the article for easy circulation of the steam inside an autoclave. Close the lid and tighten with the ring nuts and bolts which on autoclave to heat the water. Open the vent valve to come out air first and then steam continuously for 5 minutes. Close the vent valve, allow to rise the internal temperature and pressure. Now maintain the holding time, holding pressure and holding temperature under following condition. So we have to select any one of the following sterilization condition for this practice. Either you can consider 10 lb per inch square pressure, 150 degrees Celsius temperature and holding time will be 30 minutes. But generally we select second one, that is 15 lb per inch square pressure, 121 degrees Celsius temperature and 20 minutes time. Switch off autoclave, allow it to cool and pressure to come down to 0. Open the vent valve, remove the compressed steam and then open the lid. Wait for 10 to 15 minutes to reduce the chance of breakage. Then unload the articles carefully. Then second equipment is hot air oven. Hot air oven is used to carry out sterilization by dry heat method. The hot filtered air is uniformly distributed in the oven. All microorganisms including bacterial spores can be destroyed. Dry heat kills the microorganism by oxidation of cell protein. It is generally used in hospital for sterilization of fats, oils, powders, surgical instrument, glassware is used in hospital, glass syringes, needles, surgical catgut, heat stable non gaseous product, physical indicators like thermocouple, resistance temperature detector, data loggers, periodic leak test, chemical indicators like witness tube, filter paper strip, temperature tube, Brown's tube and biological indicators like Bacillus subtilis can be used for the evaluation of hot air oven. Advantages of dry sterilization. It is more suitable method for the sterilization of a substance which are destroyed by moisture, example oily substance in dry powder. Glasswares like flask, test tube, pipette, all the glass syringes etc. can be easily and thoroughly sterilized, which may not be possible in moisture sterilization. It is less damaging to glass and metal equipment than moist heat. Disadvantages of dry sterilization. It requires very long heating up time, high temperature and long exposure time. Most medicaments, rubber and plastic articles are thermolabile which can get destroyed by this method. Preparation containing of water, alcohol or volatile oil cannot be sterilized by this method because the liquids may evaporate at a high temperature. It is unsuitable for the surgical dressing because natural moisture of fibers quickly vaporizes which leads to deterioration and ultimately charring may take place. Then working of hot air oven. Clean the article properly and air dried or dry in hot air oven at 65 degrees Celsius if required. Then pack, wrap the article with suitable wrap like muslin cloth, filter paper, brown paper, thick paper, etc. Load the article in hot air oven by maintaining sufficient space between the articles for easy circulation of hot air inside the oven. Leave some perforation uncovered. Switch on the oven, record the time required to reach the sterilizing temperature which is known as lag time. Allow the rise in initial temperature. Then maintain the holding time and holding temperature under following conditions. So generally we use 170 degrees Celsius as the holding temperature for 1 hour. Switch off the oven after completion of holding time. Allow oven to cool and load the articles carefully. Then comes membrane filtration assembly. Membrane filter have become common among ultrafiltration method because the membrane used have been refined to the great extent They are very fine, made up of cellulose, polyvinyl chloride, nylon, and other cellulose derivatives. They are very fine, having wide range of a pore size, 8 micron to 0.22 micron. However, for bacterial filtration, membranes with a pore size of 0.22 to 0.45 micron are recommended. For use, these membranes are fixed in the funnel of a desired size and shape, as is done in case of sintered glass funnel. The rate of filtration is very rapid through these membranes. The advantages are efficiency is nearly absolute, filtration media are non-hygroscopic, pores are slowly clogged. It has a considerable thermal stability and may be utilized by the moisture sterilization before use. Membrane have considerable mechanical strength and allow high pressure to be applied across them. Membrane are resistant to many acid as well as organic solvent. Membrane filters have low ash values, very high wet strength, and easily rendered transfer. Bacteria are removed by sieving. Adsorption of medicament is negligible. The new disc is used for every new filtration. They do not liberate particles or chemical substance to the filtrate. Disadvantages are fine pores may get clogged easily, which are pre-filter may be used to remove collateral matter. Chemically, they are less resistant and are soluble in certain organic solvent like ketones and ester. They are very brittle. When they dry in this condition, they can be stored for the years together. Then working of the membrane filtration assembly is as follows. First, to conduct the experiment in aseptic condition in aseptic laboratory. Take the membrane filter and attach to the membrane filter holder. Attach filter holder to the sterile container with the help of cork. Connect the device with the vacuum pump. Add the solution to the sterilizing filter holder. Start the vacuum pump and apply the vacuum. After the solution from the container to container, transfer the solution from container to container in which it is to be dispensed aseptically. Close the sterilized rubber closure and seal the aluminum cap aseptically immediately. So this is how membrane filtration assembly works and all the sterilization chamber works. Thank you very much. Thank you for your patient listening. Thank you and see you in the next practical. Thank you.